Well, welcome. Thank you so much for joining us. It has been an extremely interesting summer here on campus. I'm sure your summer has been interesting as well. I'm really excited to share with you all some information regarding our reopening right now. I've been working on some of this exciting news for the last few weeks to make sure that we're opening in a way that mitigates as much risk as we possibly can when we come back to campus. So I'm super excited to have you here. I'm watching the attendees sort of roll in. It looks like we've got almost 100 people. Something just about the format here. The last time I did a webinar, I answered, I think, over 100 questions, and it was like over 90 minutes long. This meeting will not be that long. What I've done is I've taken the questions from people who have signed up and who submitted questions early, and I've tried to condense them. So we'll get to your questions here in a second. But the first thing here that I'm super excited to tell you guys about has to do with staffing, and it has to do with how we're going to plan on managing some pandemic-related things. And I've been really pleased so far with our selection, and we asked Kim Jacobs, who is our athletic trainer, full-time athletic trainer, to go ahead and be our pandemic response coordinator. And she has overseen a number of different things if and when we have outbreaks on campus, if and when we have a case that we need to report to the Southern Nevada Health District. She's going to spearhead all of that. So it's going to funnel through her office on campus. I was managing most of the pandemic response discussions, decisions, and so forth for the vast majority of the summer. And then with school coming, it just became a little too difficult for me to manage it all. So I'm really excited. Kim has been doing a fantastic job. So Kim is, as I said, if you're just joining us, Kim Jacobs is going to be our pandemic response coordinator to try to shepherd us through the school year. The next thing that I'm really excited about is something that we've added to our cleaning protocols. Not only have we upgraded our cleaning protocols, we're adding staffing during the day. We're adding to the number of times that we clean restrooms in highly touched areas, just on an ongoing protocol basis. But we've also added a device that is an electrostatic disinfection device. And what this is, if you haven't seen these things, they sort of come with a backpack, and it's an electrostatic film that you can use to disinfect the air. These things, you're not supposed to enter a room within 20 minutes after utilizing this device, so it would be something that we would use at school after school. If we had a hot spot or we had a concern about a classroom or anything else, it would completely disinfect the entirety of that room. So that's a level of security that we're excited about. Once again, that's electrostatic disinfection, and it's not something that we feel like we can use during the day safely around children, but it is something that we've added to our protocols. The next thing that's really exciting, I know that there's been a lot of questions about thermometers and temperature taking and so forth. We have had the opportunity to join forces with a company called Remark, and we are the first school in America to be utilizing the thermal imaging technology that they provide. Now, they've been working with law enforcement, with hospitality groups, and with a number of other industries for years now in not only thermal imaging, but some other things in terms of crowd control, crowd counting, and different things like that. But we're strictly using them as a thermal imaging camera system. So all students who arrive on campus and all faculty who arrive on campus will pass in front of the thermal imaging camera, and it will tell us whether we have anybody who's suffering with a fever. So we can get more into those protocols here in a second regarding what to do and what we will do if we see that someone has a fever. But what this means more than anything to me is that we're going to have kids arriving on campus and walking to their classrooms. We're not going to stop in a sort of triage way and take one temperature after another, right, as kids come in. Kids are going to be able to arrive on campus and go to their classrooms and see their teachers. It's not going to be normal. It's going to be different than it's been in the past. We're going to have kids with masks on. We're going to have teachers with masks on. It's going to feel different because of the distancing. But this was one thing that we could do to keep kids feeling normal and safe and like it's something like a regular school day. So kids will be able to walk in, for example, into the lower school where they always join in after carpool. They'll make a quick left turn and go through the common where we have the imaging set up, and then they'll be off to class. So we're really excited about that addition. Like I said, we're the only school in the country to partner with Remark, and certainly the only school in Las Vegas with this level of technology to detect fevers. Now, the last piece of information that is what I'm most excited about sharing with you. We've had the opportunity. I met with the Board of Trustees 3 weeks ago or so in an emergency meeting, and I had indicated to them that I really felt the only way to really keep us as safe as possible, to mitigate as much risk as I could on our campus, was to develop a surveillance testing protocol. And what that means is, in order for you as parents and for us as school leaders to feel as confident as possible about sending ourselves and our students and every other community member into the classrooms, that we ought to have an opportunity to test, right? And that is not an inexpensive proposition, as you well know. Some of you, I'm sure, have paid for tests, and insurance companies are pretty reluctant to pay for tests in asymptomatic individuals. But those are the people we need to find, right? So I have developed a partnership with UMC, which is, I believe, the best in the business in town. They can process 10,000 samples a day. They're getting back to people within 24 hours right now. Every single faculty member and staff member, including custodians, coaching staff, and anybody else who's going to be in constant contact with kids, will be tested tomorrow morning. So we'll have a clean bill of health according to an individual swab of every single community member, every single faculty and staff member tomorrow morning. And so we'll know by Friday if we have anybody on campus that ought to stay home and to protect the community. In addition to that, we're not just going to do testing the one time, because like I said, the best way to keep us safe is to develop an ongoing surveillance testing protocol where you're constantly testing people who may or may not, who will likely not, in fact, have symptoms. And so every week, we've developed a plan to test 10% of our school population. That means every other week we'll be testing the entire faculty, right? So half the faculty will go in week 1, half the faculty will go in week 2. In addition to that, we'll be developing a plan to test individuals, family members, students, and so forth randomly throughout the campus. And we'll reach out to you in the coming days to see if you want to get on that list to have your children tested on an ongoing basis. And, you know, if we can test 100 people out of our community every week, out of 1,000 people, think about how that will allow us to make really good decisions about the health and welfare of our community. We will know if there's an outbreak, for example, developing in the middle school. We will know if there seems to be a number of people in, you know, one wing of the lower school or something like that. So we can actually make really informed decisions about how to safeguard, how to avoid risk in our school community based on real facts and figures. And the plan right now is to continue that testing protocol at least through the first semester, see where we are at December, and likely continue it if it's working for us. So that is, I'm in contact with school leaders from around the country. So far as I know, we're the only school doing surveillance testing at this level. And I'm really proud to say I'm proud of our Board of Trustees for being visionary enough to understand that if we're going to open schools, if we're going to welcome kids to campus, that we need to do so in a way that gives reassurance to everybody who's going to come to campus. So I'm really excited about that. If you have questions about these issues, you can email me directly. I've spearheaded these 3 issues between the electrostatic disinfectant, the thermal cameras, and the testing. That these are sort of 3 pillars of our safety protocols that have really just come into focus in the last couple of weeks. So I've signed agreements on all 3 of those fronts, and we're really excited and ready to go. With that, moving on, I would like to move on to your questions. And like I said, if you have questions about this, please feel free to email me. And if you have questions about how it's going to be handled in specific divisions, reach out to your division director. They're aware of how this is going to work. But once again, we're very excited about moving forward. As regards your questions, please understand that I've tried to group them together. right? So I'm not answering a slightly different, nuanced question that really is trying to get at the same thing. So if I'm not getting at the core of what you have asked, or if you feel like I missed your question, either reach out to me or feel free to reach out to your division directors. They've got much more specific plans about their individual divisions, and I'm mostly trying to focus on issues that affect multiple divisions or issues that are really school-wide. All of the individual division directors' Q&As are available on My Meadows. Okay, so it's in your My Meadows portal under My Messages, right? So you should have received an email that has a recording of that. Barring that, you can go to our school's YouTube page, and we've made all of those public, so you can just go to those and watch those Q&As from each one of our division directors. They have a lot of really good information. If you don't have the answers, please feel free to reach out to us individually. The next thing that I want to note before I get into the specific questions is just a note on patience. We have been dealing with this as a school, right, since the shutdown in March. And I want to make clear to you, our school community, that this is all I've been working on. We had some hiccups, and we tried to make some changes on the fly when students were in the classroom in the spring. But really, I've had my sights set on August 17th since the shutdown, saying, trying to gauge safety, trying to gauge health and wellness, trying to gauge what's happening in the community, trying to gauge numbers of infections and what our county looks like, and what the national climate looks like, and what schools are doing, and what's required of us from the government. And so I've been sort of absorbing all of this. And for a lot of our faculty, I'm seeing, and a lot of our families, I'm seeing that the last 3 weeks have really compressed all of that thinking. And you, in a lot of ways, are doing a lot of thinking, and probably all the thinking that I started doing 4 or 5 months ago. So I have that kind of benefit of, I've been sort of turning this over in my head in a way that some may not have. Obviously you were thinking about it, but I've been really deep in it. And so I empathize with sort of feeling like you're drinking from a fire hose at times. So I ask that you be patient with us. We don't have every single answer. We cannot guarantee anything. What I can tell you is that the steps that we've taken are steps unlike any school, definitely, and the vast majority of public and private institutions. The Meadows School campus is going to be one of the safest places around, just in terms of our risk mitigation. The other thing that I want to bear in mind, and this is a question that came up in the questions that were offered, and that has to do with all of these new rules and all of these new protocols and everything that we're trying to put in place in the interests of keeping the school open. Because at the bottom, we really feel like having school open is what's best for children. If we didn't think that was the case, we wouldn't be opening school. But we are aware that this is going to be a different year. And I want to just point that out. I want to say that out loud, because I think all of us really want for school to be a haven. We want school to be a safe place and a wonderful place, and a place where kids yearn to go, right? It's in our mission that we want to develop a lifelong love of learning. And we share your concern that these rules and protocols are going to be tough. But we're all going into this with the mindset that we can do this, and we can do this right. We can do this in a way that's going to get kids excited about coming to school. We're going to do this in a way that makes them thrilled to see their teacher, mask and all, and to come to school and to do the things that we've prepared for them. We think it's going to be a great year. The final note that I would like to make is just that we have a social contract, and that went into the opening of the appendix of the student parent handbook. All of you should have received it. If not, it's in My Meadows, in your portal, in your parent portal, and it has appendices at the end which are specific to COVID. And what I wrote in there is that we have a social contract with one another. What I do off campus will impact your children. If I decide to not wear a mask and go into crowded places, that impacts your kids. That's true of every faculty member. That's true of every parent, right? If you decide to take vacations and not mask and not take care and not exercise caution and hand sanitizing and hand washing and social distancing, well, that impacts the rest of us. And so I just want to remind everyone that as a community, we have a responsibility to take care of each other. And that's how we're going to get through this. And that's how we are going to make sure that the Meadows School is stronger than ever before when we come out the other side of this pandemic. So let's sort of launch right into it. I got a number of questions about what other schools are doing. And I can understand that. Other schools have their own protocols. Like I said, I've been in contact with the heads of Las Vegas independent schools almost weekly throughout the summer. We were just sort of comparing notes, seeing what other people were doing, how they were thinking about this, how families were reacting. Other schools might be doing different things. Rest assured that I am aware of plexiglass, right? I'm aware of different protocols the different schools are using. What we have decided to do is based on the advice of a group of medical professionals that I was consulting with early in the pandemic and continued to bounce ideas off throughout the summer, based on the thousands of pieces of information that we collectively have processed on campus. And so the decisions that we've made have not been because we haven't thought about it. The decisions that we've made have to do with the CDC's guidelines, the American Academy of Pediatrics guidelines, that indicate that distance is better than plastic, right? That masking is better than face shields. And so we make decisions based on what we find to be the best science out there, not on the latest precaution that you read about in social media. So we have our overarching safety protocols, including spacing. According to the governor's demands, we'll have all children 3 feet apart or more from pre-K through 8, 6 feet apart or more in upper school. We are requiring masks from every student, kindergarten through 12. We strongly request that pre-K kids wear masks, and please send them with a mask, and we'll be reasonable about how long and how much they can wear a mask. But what we have found, and the literature has indicated to us, is that littler kids actually have an easier time with this, right? They're much more adaptable than we are, and we've all seen how adults don't want to wear masks in our community. 3, 4, and 5-year-olds, however, they take to it really quickly and easily. And we're going to be responsive, and we're going to be respectful of kids who are working through this. But if you can get your young ones used to wearing a mask right now, that'd be a big help for the start of school. We are also cohorting in beginning, lower, and middle schools. This means that kids will only have exposure to 20 children at a time in their own little cohort. And what that means is that if anybody gets sick, it'll be easy for us to contact trace, and we don't have to trace the entire school, right? Where they would have had contact with 80, 90 students a day, they'll have contact with 20. And we'll get into what that means as far as quarantining here in a second, but cohorting is a big part of what we're doing. We found that we could not cohort in the upper school because of the specific academic tracks that individual students are taking. Even freshmen who take many of the same classes, many of them are in different math classes. Almost all of them are going to be in different Spanish and Latin and French classes. So we found that our response to that had to be a little bit different in upper school. We're trying to be responsive to the needs of the kids. Finally, air circulation is another thing we've taken on. Unlike many campuses, on our campus, every single classroom has its own HVAC unit. We've upgraded all of those filters. The MERS rating, I can't remember the numbers, but it's an upgraded filter, high efficiency filter. And we're going to keep those fans running constantly. And it doesn't mean that we'll keep the AC running, but it means that there is constantly fresh air cycling into the classroom. In addition to that, we've established 3 different areas on campus that have tents, right? So that there's outdoor spaces primarily for singing and arts classes, but the kids will be able to be outside and go to class. You'll see those tents when you come to campus on Thursday and Friday for open house. And so finally, a question came up as to how often kids are going to get up and get out of their seats. And there's 2 questions about that. One is, how can you distance if kids are getting out of their seats? And the other is, how can you keep kids in a classroom for 8 hours a day? And those are, like so many questions, are competing questions. What we decided was that, yes, we do need to get kids up and out of their seats. We got to get them into the outdoors as much as we can. And we've got to break up the day for them so that they don't get the stultifying effect of sitting in one seat and staring, for 3 or 4 hours at a time. And so what we've done in the middle and upper divisions is we've made all the hallways one way, right? And we're being creative about releasing kids into the hallways so that we can send kids outdoors in between classes, right? And so the kids are all going to be moving in one direction in hallways, which is going to really severely limit the number of kids in any given hallway at any given time. So that's one of the ways that we're doing that. But we also are adhering to an understanding of exposure that the CDC gives us. And exposure is, over 10 minutes within a close proximity. And so if you have a millisecond where you have passed within 5 feet of somebody, that does not count as exposure. All right. It doesn't count as somebody that the Southern Nevada Health District would try to seek out in terms of contact tracing. So we're not being cavalier, but we are trying to pay attention to the science and what the scientific community is telling us. That went a little bit far afield. This question I really like. Will the Meadows School be regularly assessing the effectiveness of their safety protocols after school reopens? The answer to that is yes. I said to a school leader today, I said, I feel like we reassess our protocols every 3 days. And he said, I feel like we do it every 3 hours. It's been a really moving target over the course of the past 4 months. And we're going to be constantly reassessing. The follow-up question to that is how frequently and what inputs will help quantify the overall effectiveness? Well, I think there's one number, right? And that has to do with illness in our community and how many students we have in a given grade or a given division or a given classroom who happen to test positive. So we will know if our protocols are working, if we need to take more stringent measures, including, thinning out the number of students on campus, and we can make changes accordingly. As you might recall, a document that went out in June called Vision 2020 indicated that we had 3 or 4 different plans for how to go back to school. We still stand ready to implement all of those if we need to, if we feel like that's the best thing for the students. Question: how many will be in each class, and will they all be seated 6 feet apart as well as at lunch? Will you make them wash hands numerous parts of the day? We're following the latest guidance from the government, which is, as I said, 3 feet pre-K through 8 and 6 feet in high school. How many will be in the class? We are able to accomplish that distancing with the normal number of students in the class K through 8. We could not keep kids 6 feet apart in the upper school and keep the normal number of classes. So I would refer you to Ms. Larson and her Q&A in the description of how that cycle is going to work and when kids are going to be in class, when they're going to be out of class, when they're on campus and off campus. But so yes, they will be seated, distanced in classroom. And as well at lunch, we are working to make sure the kids, by and large, are eating outside at lunch as much as possible. So we'd like them to get outside. If they're going to be taking their masks off, we want them distanced out. We want them to be in the fresh air and so forth. Will you make them wash hands? Yeah. We can't, it's going to be at an age appropriate level, right? You're not going to walk a 17-year-old to the bathroom and force them to wash their hands for a certain number of seconds. But there will be opportunities. We've retrofitted some old drinking fountains out back of the lower school to give more opportunities for kids to wash their hands throughout the day, because we understand there's limitations to our current facility. So we've tried to add to those, in addition to over 50 hand sanitizer stations have been added to campus. So kids, every time they come in a building, every time they come into a classroom, every time they leave a classroom, they will be asked to sanitize their hands. So that, I think we've really got wrapped up in terms of hand sanitization. So question, and this was the biggest question by far, so I want to spend a little bit of time on this. What is the procedure if someone has a confirmed case of COVID? Now, we have spelled this out in the appendices, but I want to be as specific as I can, while bearing in mind that we have to defer to the Southern Nevada Health District. And some of their advice is going to depend on the public health situation in the city. So here's what I imagine. We have the ability to handle this from the family perspective, from the cohort perspective, from the grade perspective, from the division perspective, and on a school-wide basis, right? We will be deciding on an individual case-by-case basis how best to quarantine based on, the contacts that an individual has had. If it is a student who falls ill in one of the divisions where we're cohorting, we will likely, in accordance with the Southern Nevada Health District, ask that class to stay home for 2 weeks. I think that our handbook says 10 school days, right? And that is to allow symptoms to arise if they're going to arise. Okay? And we'll be monitoring that as we move forward. That will include quarantining the classroom teacher who's in that cohort, because they will have been with that class for 6 hours a day, 5 days a week. For the lower school, that is, right? For the middle and upper, or for the middle school and for the specialists, we're keeping a much greater distance between the teachers and the students, adhering to the CDC's definition of exposure, and assuming that because those teachers are moving and because kids are clearing the room and because we're sanitizing surfaces, that those individual teachers, unless they are in a cohort with those kids through much of the day, they will likely not be asked to quarantine. But again, we'll defer to the Southern Nevada Health District. Lots of questions around family dynamics, right? If mom is exposed to someone known to have COVID, but nobody in the household has any symptoms, what should we do? Well, the answer to that is basically a rule of thumb. We're not asking anybody to do a second degree of separation quarantine. What I mean by that is, if there's someone in the household who is tested positive, the household should stay home for 2 weeks and get a negative test, right? And we can work with you on our testing protocols as we develop them and have tests available on campus. So we'll keep working with families to make sure that we can get you back into school as quickly as possible. But again, that's 1 degree of separation. If somebody in your household has tested positive, that means everybody in the household should assume that they have been exposed, right? So they should stay there. That doesn't mean that everybody in those cohorts need to stay, because we don't have a positive test. That's 2 steps of separation away, right? And so what we would likely do, and that gets to other questions about notification, right? What do we do? Who are we going to tell? And those questions become more difficult, right? But what we know we will do is, if we have reason to believe that your child has come into contact with somebody who is known to have the disease, you will be notified, and you'll be notified in a timely manner. And when I say timely, I mean that day. As soon as I know, we'll make every effort to let you know, so that you can make a good decision. And we'll let you know at that time if we're asking your child to quarantine and so forth. So I do not have a hard and fast answer to all of these questions, but we do have a plan in place to work with local health organizations and to quarantine families at home as necessary. Next question. What would be the trigger to move to online learning? I got this a lot of people asking, how many is it going to take? How big of an outbreak do you need to shut down the school? And my answer to that is not very satisfying, because no one's ever seen this before. There's no playbook. My assumption, however, is that when we as a school community and we as the school leadership feel that the absenteeism and or the distraction of an outbreak is negatively impacting either the health and welfare of our larger community or the educational experiences of our larger community, we'll take action accordingly. Sometimes that would mean closing a division. Sometimes that might mean just quarantining a grade. Sometimes that might mean an entire campus shutdown for 2 weeks to let a situation cool off for cleaning. Like I said, we will work with the local authorities, but I don't have a scorecard, right? I don't have we've hit 10, or we've hit 10 in the last 10 days, or we've hit 2 in a week, or I'm not gonna, I can't go down that road without knowing exactly how each situation is gonna play out. So if I have what seems to be a random number, and it doesn't seem to be a pattern, then I'm going to behave differently than if it looks like we have a real outbreak according to grade level or division level. A question, are you going to require testing before school of teachers and faculty? Yes. Getting 880 students tested in advance of school particularly given the difficulty of acquiring tests and results, seem to us to not be realistic. So I did ask, as you will recall, that everybody try to quarantine for 2 weeks before school started, so that if you did have any symptoms, you could address them appropriately. So again, social contract. We have to take care of each other. We need to do our best to stay home when we can stay home. We need to do our best to social distance at all times. We need to do our best to wear masks in public, all of those things. But I did ask that everybody quarantine for 2 weeks. Let's see. Question: once the school opens to on-campus classes, will parents who have chosen to continue remotely be able to get exact data on the number of new cases of COVID that have appeared in our community? The answer to that is no, because for a very simple reason. If our school is open, we feel it's safe to come to school. My son will be starting at school on Monday. We believe that it's safe to come to school. Now, that is not true for everybody, and every case is different, which is why we've given the opportunity to do remote learning. But again, I cannot get into a situation where we're putting up a scoreboard of individuals in the community who have come into contact with this virus. So if you have individual questions about, Jeremy, how do you feel like things are going? How do you feel like things are trending? I'm happy to have that conversation with you as a community member. But I can't be sending out, daily scorecards like the Southern Nevada Health District about the number of cases. Not only do I feel like that violates some privacy, even if I don't name names, I also just feel like we will make appropriate decisions about the welfare of the community. And I would just like to stress that anybody who is concerned and therefore keeping their children at home, totally empathize. I get it. But I also want you to know that you're welcome on campus, because we believe that we're able to do this in a way, because of our enhanced safety protocols, that no one else can. Okay, so no scorecards. The next questions that I had, the next series of questions that I had to do with drop-off. Drop-off and carpool pickup seem to be areas of concern. And look, they're areas of concern every year. We've got to get 900 kids on campus and off campus within 20 minutes. Not an easy feat, even in the most normal of times. So one big question about drop-off was, are we going to have to wait for our child to get temperature checked? No, we can't do that. We cannot wait until a child walks in and we have somebody come back out and give you the thumbs up on your child's temperature. This goes to really, really, really needing to take care of each other, to assess your children at home. If you want to take their temperature before they go outside and get in a warm car, please do. So our protocol is going to be, a student will walk through the thermal scanner. If they're warm, we'll ask them to step aside, and they'll sit there, and in the lower grades, there will be a person there to sit with them. In 10 or 15 minutes, they'll come back and walk back through the scanner. And if that still registers high, we'll be giving you a phone call and saying that they need to go home. That temperature procedure is going to be basically the same at every division, right? So every child is going to be walking past a thermal imaging monitor, and there's going to be a school professional in place just monitoring the kids as they come in, just seeing what everybody's temperature is as they come by, and stopping those individuals who seem to be a little warm. And warm for us is going to be over 100.4 degrees. And again, that's a number established by the CDC. I also got some questions about, what are the symptoms, right? What's going to send my kid home? And I can appreciate that. But we all have to understand that if we're taking care of each other in this time, that we're going to be more stringent than we have been in the past. So if a child is exhibiting symptoms that are in line with what the CDC has described as possible COVID symptoms, then we will ask them to go home until they're symptom-free. We're not going to require a test. We're not, if there's no other reason to believe that they have COVID and their symptoms, then we just need the symptoms to subside. And that's going to be inconvenient. But, and I'm not trying to be smart. Pandemics, as we've seen, are inconvenient. And it's not going to be easy for any of us. So another question having to do with drop-off. In the lower school, if I forget items, the rule that we've asked is that people try to make it back to school by 8:15. And the reason we do that is that we can't be monitoring the front of the school every 5 minutes in case somebody has dropped something off. So if you live further away and you need to drop something off, please just give us a call in the front office. Let us know, hey, you know what, my son forgot his lunch. I'm going to be dropping it off. I hope to get there by 8:15. If I'm a little late, I'll let you know. Right? Just be reasonable with us. We don't want it to make an ongoing thing, but we really want to try to limit the number of people coming to campus, on campus and off campus, and in buildings and out of buildings and so forth. So we're really trying to limit the amount of traffic. Okay, so please work with us, and we'll definitely work with you. As far as carpool pickup is concerned, the biggest questions that I had were, how are we going to manage this? And so the first question is, we're going to manage this by using a piece of technology called CurbSmart. You're going to get, if you have a child in lower or middle school, you're going to get more information on that as we move forward. And that is a piece of software that is going to notify us that you are on the curb, right? And so please, patience. This is the first time we will ever use it. We're going to get better at it, but this is how we can do this, by keeping kids in their cohorts before they go out to class, or I'm sorry, out to the curb. As opposed to what we've usually done is put them all in a big common together, which is obviously not something that we're going to do right now. So patience on that front. Now, what happens when I have children in separate divisions? Had a few questions on this. And look, I get the concerns. I do, and it's inconvenient. But right now, we're going to start the year asking you to go to separate divisions to pick up your children. And so, you know, what that can look like can be different depending on your personal situation. If you have children in the upper school, then they can wait in the library, socially distanced, until you arrive in the back of the school to pick up that 9th grader or 10th grader or whatever. In lower school, it'll be, you know, it'll run normally, and then you can come back to your middle school student, pick them up. Please work with us individually. And my commitment is, we're going to monitor this and see where we can find efficiencies to help make it easier for you. Right now, we're staring down the difficulty of getting 880 children off campus over the course of 15 or 20 minutes, 30 minutes, while keeping the cohorts that we've worked hard all day long together. All right, so working hard to keep cohorts together for 8 hours a day and then breaking those down in the last 20 minutes of the day for carpool doesn't make any sense to us. And so we have talked about different ideas, and we've erred on the side of health and welfare and inconvenience. And you have my apologies, but you know, it's oftentimes safety is inconvenient, and that's where we're going to be. So next series of questions has to do with masks. Do students wear masks at recess? Yes. I know that's tough for people to stare down. It's tough for me to stare down. I walk across this campus with a mask on. But we will be asking them to wear masks at recess, and we will be very reasonable. Okay? And what I mean when I say reasonable is, if you're standing in line for kickball and you're a foot away from the kids on either side of you, you should probably have a mask on, right? If you're out walking the track by yourself, or you need a mask break and you are 10, 15 feet away from anybody, great. Take your mask off, right? And we're going to try to be reasonable with kids, because we understand that this is new and this is difficult for them. So there will be opportunities for mask breaks, even better opportunities for mask breaks when it's not during the lunchtime recess with lots of children on the playground, who will be cohorted in different areas of the playground, by the way. But if you have the opportunity to go out for morning recess with your class, there's lots more space for you to go and spread out and take off your mask and you know, get a breath of fresh air and so forth. But if you ask me what's important to me is keeping the school open. We can't keep the school open if we don't do the thing that the scientists have and the healthcare community has told us prevents the spread of COVID-19. That's masking. That's the number one. It's masking, and then it's distance, and then it's hand washing. If we can't do number one, I'm afraid that we won't be able to keep the school open. And I'm sorry, I don't love masks on the playground either. But I do love the idea of having a learning environment that I can send children to for the foreseeable future. People ask about the types of acceptable masks. We'll get a communication out on that today, because even today, I just got someone sent me an article from Duke Medical that indicated that wearing gaiters, right, the sort of neck gaiters that you pull up over your nose, might actually exacerbate the spread of droplets, because it breaks them into, it not only allows them through, it breaks them into smaller particulate. So we will have a final answer on masks. We said in the handbook that we wanted cloth masks. I think we need to be a little bit more specific about that so the parents can prep. From my perspective, what I'm reading, everything I'm reading indicates that if you're more comfortable in a surgical mask, that's fine. But that for our purposes, particularly with the distancing that we're going to be putting in place on campus, that a multiple layered cloth mask, cotton is better than synthetics, but a multiple layer cloth mask will do the trick. Now, I had questions about face shields. I haven't read anything that indicates that face shields are an appropriate replacement. And so in lower school and in language classes, teachers will be making videos of themselves to sort of illustrate to classes how to pronounce words, how to articulate different things, to do some phonics in the younger grades and so forth. But there's not a replacement for masks. And this is honestly a health and welfare issue. So something that we would like to preserve is keeping masks on as much as possible. Now, if a teacher steps away 10 feet from their class and says, no, you misunderstood me, let me go ahead and say it this way, that's understandable, right? But by and large, masks are better than face shields, and that's why we will be using them. Next, a handful of questions on remote learning. Let me see what I can do here. All classes, will they all be filmed and available to be taken home? No. No, they won't be. We are going to be treating individual students like they are remote learners. If they're at home, they'll have a somewhat different experience. Now, our classes are going to be set up so that students can watch in-person explanations and lessons, but we're not going to be just plopping kids down in front of a computer for an 8-hour workday while they just have to sit there and stare at their computer waiting for their teacher to move on, right? So we're not filming the entirety of classes. So can students come to class one day and then the next day stay home and attend class? No, we can't go in and out. It's not fair to the teachers. It's not fair to the students to get that kind of whiplash and say, today I'm home, next day I'm at school, today I'm home. We're not doing that. And we can't. And A, because it's a bad educational experience for children, but also B, it's extraordinarily difficult to ask a teacher to do what we're asking teachers to do. And that is be simultaneously an in-person teacher and a remote teacher. Right? We're asking them to basically take on another class period, or another prep, or another experience that they've got to provide for students who aren't in the class. And to say, student A is going to be part of this experience now, this experience tomorrow, and then 2 days next week, I'd rather not have them at school. We've got some appointments, so we're not going to be doing any of that. So you need to work with your individual division director. If you are currently remote and you would like to come back, that's a pretty easy insertion. Barring the upper school, which because of the complexity of those classes and the fact that they have been building online classes for students who are going to be at home, that's going to be much more difficult. And we're really going to be wary about students making the jump from remote to in-person. But again, give us a conversation, reach out to Ms. Larson, but she and I are very concerned about having students jump in, midweek in an upper school experience. I don't think it's fair to the teachers. But if you are a remote learner in lower or middle or beginning and you'd like to come back to school, start that conversation, right? Give us some notice. What are you thinking about? How are you thinking about this working? What has been your experience? Let's work in partnership to make sure that your kids get the best experience that they can, okay? So we can't go on and off and on and off, but we do want to welcome the conversation. So if you like, what I imagine is going to happen is that you're going to see those of you who are looking at going remote. Some of you might find that the experience that we're having on campus is more suited to what you'd actually like to have happen. I want to have that conversation with you, okay? Because I think that we can distance and we can mask and we can have hand hygiene in a way and we can test, and we can thermal image, and we can do all of these things that other institutions can't do. I think that makes us safer. So I would love to talk to you about having your child come back to school. Depending on upper school grouping, does a student have to opt in or out to the hybrid model, or is it mandatory? There's some confusion about the hybrid model. Please speak with Ms. Larson. What we've got in the upper school is students are at school, in class, in person one day, and then out of class, but still in class the next day, right? So some of those students will opt to stay home, right, and learn remotely on their off day. Some will decide to come to school, and they'll be seated in the common or in another classroom. So with questions in that regard, there was a lot of them. So one, watch Ms. Larson's Q&A. Lots of good information there. Two, reach out to her directly, talk to her, ask questions at open house this week, and so forth. This is a really good question, and something that came up today. Question: I understand that the Meadows School is accommodating remote learning by enabling live streaming from the classroom. Is the network bandwidth able to handle this volume of continuous parallel media streaming? The answer to that is we hope so. We have done a great deal this summer to make our infrastructure more robust. We have invested in greater broadband capacity, but what we ran into today was that Cox was having outages. And so we saw some slippage in large-scale Zoom meetings that we were having on campus. So it may not be perfect. Sometimes, in fact, it will not be our fault or your fault, right? So we are going to have to work in partnership here because with Cox being the major provider in this community, with us basically going from, maybe 70 or 80 users of streaming video at a time to perhaps, 400 or 500, it's a big jump, not only for our infrastructure, but if Clark County School District is going to come online with 100,000 online learners in the coming weeks, that is going to put stress on Cox as well. So we've got to be realistic about it. We have invested in infrastructure, and we're going to continue to invest and make our infrastructure far more robust. We've been looking at that, but again, sometimes you're at the mercies of your internet service provider. Let's see. Oh, a question: can upper school students get community service hours to tutor younger students who are learning remotely? Provided that they tutor them remotely. Right? I can't have upper school students visiting your home, breaking your personal quarantine, and having to contact trace where an upper school student was as they made contact with you. So if you can work something out with the upper school and students can provide remote tutoring, that would be great. And I would welcome that conversation. So you can reach out to Ms. Larson or Mr. Ronquillo in the upper school and see what's possible. Finally, a question about standards. There was some concern about, because remote learning was so new to us last year, some students were more present than others. Some were, there were a lot of dogs barking. There were distractions in the background. There were, kids were varying degrees of present. Two thoughts. One, that's going to be remote learning. You're going to have a wide variety of students. Some are going to be very present, and their parents are going to be very present, and they're going to expect their children to be very present and on the ball. Some less so because of home circumstances or because they're trying to work from home and so forth. So we have to be understanding of one another. But we also recognize the notion that we got to tighten this up a little bit, right? And so we have put together a set of expectations that we're going to circulate to you, and they have to do with, hey, keep your camera on when you're in a meeting, right? Hey, answer to the teacher when the teacher speaks to you. Make sure that your background isn't distracting. There's basics here of online meeting etiquette that we as adults would all adhere to, I would assume. But little kids need to be reminded, and teenagers sometimes even more need to be reminded. So we're going to put together that document of expectations so we're all operating from the same perspective in that front. So two things, right? We have to be understanding, because remote learning, there's not a teacher in the room saying, hey, you're not paying attention, eyes on me. But at the same time, we understand there's room for improvement there. Um, Bathrooms and cleaning was an issue that came up a couple of times. So how will bathrooms be monitored in middle and up and lower school to make sure that there aren't more than just a few students in there at the same time? We're developing a protocol to figure out, how we keep kids in and out. I've discussed with Ms. Kennedy, how can we go about making it a design build project for fifth graders, right? We can do something early about, marking maybe a felt board or something like that, or maybe a whiteboard. Or look, I'm mindful that we don't want a lot of kids touching the same objects. Understood. So we're trying to figure out a way to mark capacity in the classroom, and we'll do so. We've been having kids go to the bathroom at school for many, many years. We'll figure this out. And so the rule is going to be, and kids generally follow the rules very well. And a lot of the times when kids go to school, when they go to the bathroom, they're going because they came back from recess and the teacher's giving them an opportunity to use the facilities and to get a drink and so forth. So there will be some monitoring there. But yeah, it's an area that we need to develop in lower school. But like I said, kids generally follow the rules. In middle school, it's going to be much the same. It's going to be, we cannot monitor the inside of the restroom at all times. What we can do is tell kids, hey, these are the rules, and we expect them to adhere to them, and students will either tell us or they won't tell us. That's why we require masks. That's why we require distancing all day long. Nothing's going to be foolproof. But I do not believe that bathrooms are going to be our Achilles heel. Cleaning. The only question I've heard about cleaning at this point has to do with how often will bathrooms be cleaned? How often will light switches be cleaned? Look, we'll take care of all of this. My assumption is that in all the divisions, the average cleaning of every bathroom will happen during right after a passing period, right? There's no passing periods in lower school, so we're talking about 5-6 times a day. Every bathroom completely sanitized, right? The daytime crew has largely been repurposed. We're adding manpower and human resources to the daytime crew. So they have largely been repurposed just to sanitizing all day long, to sanitizing after students. They're not going to be doing the kind of ongoing cleaning processes that you might expect, that we've grown to expect. But we really feel like the immediate sanitization of high touch surfaces is the very most important thing. We're well staffed at night to make sure that the entire building is completely cleaned, top to bottom, so we're good to go in the morning. Last question on cleaning has to do with the toxicity of the chemicals used. We don't use chemicals anywhere on campus that are not allowed to be used during the daytime with 3-year-olds in the room, right? And this is not what Dow Chemical has told us, right? This is what the EPA allows. So we have EPA standards that we follow in our beginning school. And those products are the same things that we use across campus. And so those are products, once again, that we use in the room with 3- and 4-year-olds. Now, are they products that we'd be comfortable having kids ingest? No. But are they 90% bleach? Absolutely not. So we do not use a single product that is active during the day, right? So it's not an active chemical. It's not an active chemical process. In fact, everything that we use is neutral when it comes to using things during the daytime with kids. That is not going to be a major issue for us. We're really comfortable, particularly considering, what we're finding is that the virus transmits much more easily in an airborne way than it does on surfaces. So given the fact that we've got surfaces that we're managing, that we're sanitizing toys and multi-use items between uses, we've got protocols to deal with this. And so on the one side, you should be very confident that things are clean. On the other side, you should be very confident that things are safe. Next question has to do with uniforms. Do we need to buy the new shirts that have the new logo? No. Question. I've heard the dress uniform will not be required this semester and can't find that reference anywhere in the videos and emails. There has been some discussion about delaying the start of dress uniform because kids are going to be outside and playing. And so wearing a shirt and tie and having a mask on at the same time, we were thinking about their comfort. There's also some discussion about the argument between what is comfortable and what is normal, right? So many of our returning students are so used to wearing the uniform on certain days. So that discussion is ongoing, and we will let you know. The fact that you can be assured of is that we will be utilizing dress uniform this year. Okay, it may not be in the first week or two. We'll communicate that with you. But if you bought a bunch of dress uniform items, you don't need to feel like you wasted your money, because we will be utilizing the dress uniform. It is part of our uniform. Finally, I have a handful of just sort of random questions that didn't go into any of these categories. So to recap, I've tried to cover drop-off, pickup, masks, remote learning, bathrooms and cleaning, and uniforms. These are the categories that I sort of put together. These last questions had to do with different things that I didn't really that didn't really go into a category, but I did feel like I wasn't sure if they had been answered in the other Q&As across campus. So bear with me. Question: I have a middle schooler who suffers from chronic allergies. It was mentioned that if this was the case, a doctor's note would be helpful. It would be helpful. If you know that your child is going to be ongoing symptomatic, talk to your pediatrician. I don't want to get into the business of stipulating what your pediatrician has to say to us, but if they could describe the symptoms, the duration of the symptoms, like this child has been having hay fever every late summer since I've been treating him in 2015, and the symptoms are X, Y, and Z, please overlook them or whatever, that's what we're going to go with. But what we don't want to do is have someone say, oh, that cough, that's just his allergies. If a child comes to school with a persistent cough, we will send them home. And you will need to get some assurance from either some assurance from a pediatrician to let us know that we're protecting the entire community appropriately and doing everything we can, or those symptoms will need to subside. And now if what you've got is a chronic situation, it sounds like you've got to go to the pediatrician side of things. Okay. And I know that this is the issue. This is an issue for a lot of us. I suffer from seasonal allergies myself. And so, I've tried to be really careful about taking my allergy medications and avoiding things that are going to make me symptomatic in terms of allergies. But we're going to have to deal with this with each other. So communication is the way through. Is football and basketball still in the fall? Well, basketball would be a winter sport, but I get your point. Football and basketball, everything has been moved to second semester in terms of interscholastic athletics. That's middle and upper. So we're not going to be running any interscholastic athletic events until January. And so what that has looked like for the NIAA is that they have tentatively planned shortened seasons for all three sports. So we will start, I believe, with winter sports and then do fall sports after that and then do spring sports last. Probably no playoffs, perhaps no state championships. But we do want to give these student athletes the opportunity to participate if we can. In the meantime, Mr. Grubert and his team in the athletic department have really worked hard to try to put together an athletics/fitness experience that is going to keep our kids active, going to keep them healthy, going to keep them engaged. So if you're curious about that, please reach out to us. I think he just had an athletics Q&A a couple days ago, which I think was well received. So let me know if you have questions and I'll send you in the right direction. Plans regarding counseling and counseling services, particularly in the environment that we're currently in. And this question had particularly to do with lower school. I just got off the phone with Ms. Hirsch maybe 30 minutes before this webinar, and she and I discussed how excited we are for her to have an expanded presence in the lower school in terms of just supporting kids in the weirdness of this time. They're going to be coming back after a long, long break. They're going to be in classes with masks. They're going to be in classes distance from their classmates. Their playground's going to look a little bit different. Some of our rituals are going to look a little bit different. Our traditions are going to look a little bit different. And so we want to make sure the kids feel comfortable and confident and supported in returning to school. And I take that really seriously, because one of the main reasons that we're coming back to school at all is because of our firm belief that having a social life and having a social experience and having an in-person educational experience is so vital to the health and well-being of students. That's why we're going through all of this. It'd be, frankly, probably much easier for everyone from the school's perspective if we just went remote. Probably less for many parents, but we're doing this because we believe in it, and counseling services are going to play a role. So counseling services are going to be in all 4 divisions. and working with individual families and kids as the need arises, but also working with individual families and kids, working with individual classes, managing and helping to manage advisory, doing drop-ins and different things like that. I also want to mention that in the lower school and across campus, we staffed up in various areas. We've hired an extra co-teacher in the lower school. We've hired a learning specialist in the lower school, because what we saw in kids who had no issues until remote learning really started to struggle. And we want to make sure that every child in the school is supported through this difficult time. So we're really pleased to have added a learning specialist. I'm going to get an email out to the community soon about all these wonderful people that we've added. We added extra help in the middle school to provide coverage during break periods and subbing. We're looking at perhaps another sub in the lower school. We're looking at some long-term subs in the upper school. So we're really staffing up in order to make sure that we manage this thing appropriately on our campus. So we take the in-person thing very seriously, and counseling is going to play a role in that. Another question was about lockers. We made the determination that lockers were not going to be workable in the middle school, because if you've ever seen the passing periods, students are getting stuff out of top lockers while students are getting stuff out of bottom lockers. And we did not see a way to spread out the lockers to keep students socially distanced during that transitional period. So we've tried to do everything we could to lighten the load in the backpacks and to really, use online materials where we can. But also, there's a whole email chain going around the middle school this week to say, okay, what are we asking in this class? What are we asking in this class? Let's try to keep the numbers down so that students don't feel like they're carrying around a 50-pound knapsack in between classes. But currently, we will not be using lockers in the middle school. In the upper school, we will be using lockers because of the layout in the upper school, and because, remember, we're asking only half the students to attend classes on a given day, right? So that's going to cut down our numbers substantially and allow us to socially distance in passing periods in a way that we otherwise might not be. So there is a difference between those two, but there are rational reasons for the differences. We felt that it was important to keep as many kids on campus as we could, and then just found that the upper school we couldn't. So putting half the number of students in a class meant that we had fewer students to worry about in passing periods. And finally, a question that I really, really appreciate. It is, what can we do to help you and the teachers as we return to school? Are there specific talking points that you'd like for us to have with the kids to help reinforce specific safety initiatives at school? I would like, if you would just humor me. I know this is hard in my household, but one of the biggest things is to be able to remind your children that we're all doing the best we can, that everything that we're doing at school, you personally as a parent might not agree with it. And I understand that. I've been, like I said, going through this for the past 5 months, and I've probably made 100 decisions that I've gone back on because I've learned new information. And it's very frustrating to me. I don't like to lead this way. I don't like to plan school years this way. And I know you can be frustrated too. But the biggest thing I think is to try to stay positive for your children, because if they're coming to school, they need to be excited to come to school. It's going to be a fun year. It's going to be great. We're going to be doing some really amazing things with them. So I would ask you to try to stay positive and stay confident in what we are doing. Have them wear a mask. That's going to be really important. And please, the biggest thing that you can do is to communicate with us. Let us know how things are going. That doesn't mean, maybe a daily rundown on everything. But if you have concerns, if you have suggestions on how we might improve, come to us with an open ear. And I hope that we'll be able to explain to you why we're doing the things that we're doing and when we are not. So thank you, all of you, for your support. I see there's a hand up in the attendees. But in order to honor everybody in the room, I would just ask, I don't know who that is. So whomever has your hand up, will you please just email me and I'll be happy to give you a phone call. And if anybody else has questions that are follow-ups, I would love to engage with you personally. I want to be respectful of everybody's time. We ran over our hour that I've allotted. And I want to just, like I said, be respectful of the moment and the questions that came in. and I've tried to answer. So if I haven't gotten to you, or if you feel like I've missed the answer, I really, really do welcome your communication. I love this community. I can't wait to see your children, and we'll be around. We're going to come out of this thing in great shape, and I'm super confident about that. So listen, if you have questions, you know where to find me. I'm here at school, and take care, all of you. Have a good day. Bye-bye.